Welcome to SDHC's Health and Wellbeing podcast. Before we begin, we want to emphasise that the information shared in this podcast is for educational and informational purposes only. While we strive to provide accurate and up-to-date content, it is not a substitute for professional medical advice, diagnosis or treatment. Always seek the guidance of your doctor or other qualified healthcare provider with any questions you may have regarding a medical condition. Never disregard professional medical advice or delay in seeking it because of something you have heard on this podcast. Remember, your health and well-being are invaluable, so prioritise consulting with a medical professional for your personalised care. Hi everybody, you're listening to the Health and Wellbeing podcast from South Downs Health and Care with your host, Dr. Nick Harvey. The purpose of this show is to help people understand how they can help themselves and others with their health and well-being. Every episode, I interview an everyday expert to understand the latest evidence and advice on how to improve your own health and help others. This month, I'm excited to welcome Robert Ralph. Together, we'll explore a vital topic, supporting patients prescribed dependence-forming medications. That's like a tongue twister. Welcome.
Hi.
So with a background in autism-specific work with adults and experience in mental health, Robert transitioned into a field of substance misuse over 17 years ago. Throughout his career, he's led teams providing access to substance misuse treatment, needle and syringe services, drug rehabilitation requirements, and alcohol treatment. In 2018, Robert spearheaded a pilot service at Station Practice in Hastings, focusing on deprescribing of dependence-forming medications. The success of that pilot led to the development of a county-wide service in East Sussex. A year ago, this service expanded to West Sussex, where Robert continues to make significant contributions to improving substance misuse support services. Welcome, Robert. Yeah, thank you for joining us today to delve into this really important topic.
Hi, great to be here.
So, as always on these episodes, I'm quite keen to delve into a little bit about you. So, I can imagine that this kind of work's really demanding. So, how do you cope with that? And tell us a little bit about you outside of work that is the canvas for which you can paint on that one.
Well, I think that substance misuse work is particularly demanding, but the dependence-forming medications work, which, as you say, is a bit of a tongue twister, is actually really rewarding. It can be tricky to get people involved, but yeah, I a bit about me out of work. Well, I've got 2 children, so although they're teenagers now, they still keep me pretty busy. And yeah, I've just stopped playing cricket after 35 years of chasing leather around various fields and village greens and bowling rather badly, carted into the bushes quite a lot.
Teenage children. I've got a couple of teenage children. Any secrets there? I find it really challenging.
Yeah, I had a long conversation with them both yesterday because it is quite challenging. And I think some of the challenge for me is adapting from, okay, they're children and I look after them, to, well, they're very able in many ways and quite adult in their outlook in some ways, but they're not quite adult. So it's 1 minute you're talking, you're dealing with a child or childlike behaviour, and the next minute you're dealing with a young adult. It has plenty of rewards as well. Some of the conversations I have with them are really quite enlightening. But I think it is challenging being a teenager these days, when people always talk about social media, but I think they haven't had the opportunity really to get out and get into rough and tumbles like I did when I was a boy. I was always out and about playing in the street, and children today, I don't think they've grown up in that environment.
No, it is a challenging time. I'm not sure I'd want to grow up now.
No, I think we had more fun really, and became a bit more resilient because of that. So yeah, I do think it is difficult. And my eldest is looking for some part-time work at the moment, and it's all online. You can't just go and have a chat to somebody and give them your CV or whatever. It seems to be, you've got to apply for it all online, which feels quite impersonal. It doesn't really give you a chance to sell yourself too well, I don't think.
No. There's a bit of a segue here then, isn't there, into substance misuse I'm interested to explore. What are your thoughts about Gen Z and the behaviours that they have because of this, what we're talking about, this kind of very digital, social media savvy generation? Are you seeing differences in behaviours with medications?
Yeah, so been working in substance misuse quite a while, and what we're seeing is an ageing population of traditional patients, service users. So those that are using perhaps heroin and crack at the sharp end of things and committing crime to fund that, they're getting older and sadly something's starting to die off, really. And we're getting less and less young people coming through that way, but we're getting more and more people coming in who are using other substances. What were called legal highs or novel psychoactive substances became really quite prevalent at one point, and then the law changed. That has subdued that somewhat. So we're getting less people coming through taking things like methadone and whatnot. But there's huge amounts of people using and misusing cocaine and alcohol in combination, which is really dangerous. Yeah, so those kind of party drugs, ketamine starting to become a little bit more prevalent, things like that. So the kind of landscape of substance misuse is certainly shifting.
Mm-hmm. And is there anything about our lifestyles now that you're seeing over, your 17 years in the field that means we're more or less likely to kind of cope with these risks?
That's a difficult question. I think most substance misuse, once it gets to the stage where people need ongoing support and treatment or quite intense treatment for a short while, is kind of driven by past trauma, in my experience. That there aren't many people that we deal with for any length of time that have not got some kind of really difficult background, childhood trauma, or even extreme trauma as an adult. That leads me to believe over time that the vast majority of people are kind of, whether they realise it or not, are kind of self-medicating. They're taking these substances to cope or to give them some escape from this situation, from the way they're feeling and thinking. So, and then of course that becomes quite habitual and it's quite hard to break out for a lot of people, particularly if you haven't got that level of resilience and coping skills that you would hope to have as a functioning adult. If you've been living a difficult life, a traumatic life, often in very deprived circumstances, then it is difficult to develop those skills as you grow up. And then, you start taking substances and it kind of impedes your development even further.
Mm-hmm. Thanks for highlighting that, because it's so easy to look past the real vulnerability that there is underneath a lot of these behaviours, isn't it? Mm-hmm. I wonder whether I hate generalising. I've done this now with talking about Generation Z and things, but I do get the sense that this generation is better at talking about how they are and sharing that. Is that something you're seeing, or do you think
it feels that way? I mean, the organisation I work for is Change, Grow, Live, and for example, we give the staff an hour each week to spend on their own well-being. So we're able to take an hour somewhere in the week and focus on our own well-being. And it's little things like that, I think, that put the focus back on kind of what's going on for you, what's really happening. During COVID, I linked up with some colleagues and we had a little support hub. So it was online, on video call, and we would talk about how we are. And I think people are slowly becoming more willing to talk about or what's happening with their mental health, with their emotional well-being, and some of the things that maybe back in the 80s, 90s, we said they were a bit hippy-dippy, a bit airy-fairy, things like mindfulness and breath work and yoga and things like that are starting to become a bit more mainstream, I feel, certainly talking to colleagues and whatnot, and we're starting to really see some of the benefits.
Yeah. What a great thing to do at CGL, to have an hour dedicated to your own well-being.
It's really helpful sometimes. Yeah, it's it's important that people take that hour. Really, I always encourage my team to take that hour. The temptation is to kind of, I've got too much to do, I'll crack on. But actually, if you take an hour out and do something really nice, and we've had a couple of staff who are trained in auricular acupuncture, so that's, as I call it, sticking pins in your ears, or they use magnets and little things on your earlobe and on the top of the ear, and that's very relaxing. So we've had sessions doing that, and mindfulness sessions, those kind of things have been quite useful. But a lot of people will go to the gym or go for a walk along the seafront or something like that. And there's many things that we can do. We do kind of share those ideas with each other a bit, so that's quite helpful.
Mm. Yeah, great for you guys practicing what you preach. I've dragged our conversation because of my fascination around substance misuse, but you're here to talk more around the dependence forming medications that we often prescribe. So I'm interested to delve a little bit deeper into that. So these medications can be essential for many patients, can't they? But also obviously carry risks. So what are the most common misconceptions that people often have about dependence-forming medications? And maybe you want to expand on what we're referring to as well.
Yeah, absolutely. So that'd be a really good starting point. So my team commissioned to work with opiates and opioids that are prescribed. So they're usually analgesia for pain, and they can work really well for acute pain, but not so well for chronic pain. So that's pain that's going on for more than 3 months. So I'll talk a bit more about that in a minute. Also, benzodiazepine is the most commonly prescribed benzodiazepine is diazepam, and they can be really difficult to wean off of, to deprescribe. GABA medicines. So GABA medicines are pregabalin and gabapentin, and they can be prescribed for a number of different reasons. So as an anti-seizure medication, sometimes for neuropathy, so it's nerve pain or nerve issues, and also sometimes for anxiety. So a bit of work always to do to figure out why they're prescribed before we start recommending any changes to those. And Z drugs, which are things like Zopiclone, Zolpidem, that are usually prescribed for sleep issues. So I think the most common problem with the prescribing of these is when they commence prescribing, clinicians are not always clear on what the longer term effects may be in terms of dependence and in terms of what that means for the person moving forward, and whether they're going to be prescribed kind of ad infinitum for the rest of your life, or whether this is a course of medication to get you through a difficult period and move on from there. So yeah, in our work, we're always encouraging clinicians to have those conversations as openly as they can at the start of any prescribing. And I think for people in primary care like yourself, you're often picking up prescribing from people who've had a hospital admission. So they're there in secondary care. They come back into primary care. Your GP will pick up this prescribing. They've been told, or they've been prescribed at pain clinic. And it can be quite difficult to kind of move the conversation round to kind of, are you aware of what the long-term effects can be of these medications? And it's not just dependence. If you look at opiates and opioids, there's an awful lot of longer-term side effects, things like hormonal changes, actually an increase in pain over time, a condition called hyperalgesia or conditioning, which can mean that they start to amplify the pain through the constant kind of flooding of the opioid pain receptors in the body and brain. And coming off of those medications can reduce the pain. And I had to see it to believe it, because when I read all that kind of research, and then when you start reducing people down gently, it's really important don't leave them in a worse position than we find them. We say that to all our patients when they come in for support. We want to leave you in a better position than we find you. But as we start to reduce those, the chronic pain is often either unchanged or slightly changed, might slightly go up and then come down again. Overall, we see on average a 10% reduction in pain from people who have weaned from or been deprescribed opiates and opioids. Yeah, so other effects of these medications can be kind of quite long term and quite pervasive, but subtle in the way that you see them. So cognitive impairments, they start to think less clearly, and maybe you put it down to, well, I'm getting a bit older, so, my memory's not what it was, or I find it difficult to plan things out in the way I was. And those kind of issues can lead to real increases in anxiety and low mood. So people can become kind of slaves to their medication, so they become more isolated socially. A lot of people we work with are dealing with real chronic pain issues, and that can be incredibly difficult to live with day in, day out, feeling that pain. And we see a lot of people who've, their lives have really been torn apart by suffering with that pain. So they've lost their job, often their relationship, sense of identity, really. And that kind of decline, that loss of their hopes and dreams can lead to real issues and low mood. And one of the things we really focus on is engaging those people and giving them time to tell us their story. If you're a chronic pain sufferer and you go and see the doctor's only got 5-10 minutes, so they can't hear your whole story. Your family, friends, you probably don't want to keep repeating it to them. So actually we come along and give them a fresh ear. And hearing someone's pain story can be really powerful for them. If I ask somebody in chronic pain to tell me about their pain, they're unlikely to say, I woke up this morning and my back hurt. They'll probably say 15 years ago I had an operation or an accident or I got this condition and then I saw this doctor, then that doctor, I was prescribed this, then they changed it to that. That was horrible. Then I went to this pain clinic. That was no use. And they'll tell the whole story. And actually, one of the good things about our service is we do have that time to really hear their story. And there's a lot of power in being heard, and that helps them to build a relationship with our workers and start to explore kind of what might be a way forward then.
Mm-hmm. And what do you find are common on-blockers? Because I guess in my experience as a GP, I'm also starting the conversation with a little trepidation because it feels like you're taking something away. And that's very much how I think people feel too. And to break through that and to really kind of help paint a picture of how things could be if we go through a little bit of a rocky period while we reduce. How do you manage to kind of open up those conversations?
That is the $64 million question, isn't it? Because it is really difficult for a doctor. You've only got a few minutes as well. You haven't got long. But yeah, going back to kind of when they were prescribed, were they given the information that they should have been given or would have benefited from at that point? So were they told, there are long-term health implications to being on these medications? And also thinking has changed in the medical community, particularly around chronic pain and opioids for chronic pain. And it was felt that they were helpful. Moving on and on. And I'm led to believe that this is because the World Health Organization developed an analgesic ladder, a ladder of kind of, 10 mils isn't working, so you go up to 20 and up to 30 and so on. But that was developed for cancer pain treatment. And it's still shown to work for cancer pain and palliative care, opioid prescribing, but not ongoing chronic pain. So people, that was extrapolated, that analgesic ladder and kind of taught to clinicians and physicians that this is how you treat chronic pain for years and years. And now we're kind of having to unlearn that. So you've got the clinicians trying to unlearn that and then trying to find ways to explain we've been doing it a bit wrong for all these years to patients and really move forward in a kind of a much more holistic, which I know is a catchword, but yeah, looking at the person as a whole and trying to get people to recognize that if they've got a pain issue or an anxiety issue, then actually the most important thing is that they take as much control of their own life and their own treatment around that as possible. And that a piece of the jigsaw is medication, but that isn't the whole issue. So trying to get people engaged in things that will give them a better quality of life. So having conversations around kind of what interests they do have, what they are able to do, these kind of things can help people to start to move forward. There are some things that will help people to deal with chronic pain moving forward or anxiety. So we run wellbeing sessions, and we call them wellbeing sessions because people get a bit scared if we say come to group. So we run wellbeing sessions. We look at things like how to get better sleep, how to be more active within your limits, but also how to pace yourself, how to set yourself achievable goals and make gradual progress, how to kind of untwist your thinking as well sometimes. So we all fall into kind of thinking traps. I was on the way over, Google Maps stopped working, and I could feel my brain starting to go into what we call catastrophic thinking. I'm not going to be able to find the place. When I do find the place, it's going to be too late. Dr. Nick's going to be too busy to see me, and kind of the whole thing collapses, wasted journey, wasted day. And that's an example of catastrophic thinking, but also we see things in black and white sometimes. We expect life to be fair, and it isn't always fair. So we can start to help people to recognize and then rationalize the ways that they're thinking. And that sounds maybe, well, why are you talking about the way I think? I need you to deal with my pain problem or my anxiety issue. Well, actually, all those things key into it. If you've got a better quality of life, then and a clearer way of thinking, and you feel like your life is becoming more worthwhile, then evidence suggests that your pain experience will be less, and also that your resilience will be higher your ability to deal with life's challenges. I mean, life's tough, isn't it? It's always throwing something at us, and we get a little calm period and then it'll throw three things at us. And it's about helping people to build their resilience because they're dealing with life and these other issues on top.
Yeah. Thank you. It always comes down to some real basics, doesn't it, in many ways of, as you said, setting goals, being open, maybe that kind of coaching approach that you're touching on there of helping people understand what's going on.
Yeah, that's really important. And building a support network, bit socialising. I mean, humans are generally social animals. And I think most of us found, during COVID that we were losing out on a lot of social interaction, and we started to become much more creative in the way that we had that interaction, started connecting with people, online and things that we didn't before. And what we find is, in Hastings, we run a peer support pain group. So people come along and they can have a jolly good moan, about their pain, or what's going on in life, or they can share a joke. We have a topic each week that we discuss, but it's not kind of overly formal. The one thing they all tell me that they get from that is it's incredibly empowering to meet other people in similar situations and relate to that and not feel, it's just me. It's just me that's struggling. And when you're looking at mental health, when you're looking at chronic pain, there's a lot of similes there in that we feel so alone with it when we become more and more isolated. And that builds our anxiety around kind of going out and doing normal things, if you like, things that other people would perhaps take for granted. And actually getting together with people, either in our online wellbeing sessions or in an in-person, in a group kind of situation, an informal group situation, can be really empowering for people. And you see some lovely pieces of support coming out then. If people come and they are able to open up, then other people share their experiences, they offer support, they swap numbers, they maybe catch up in a week in between the groups. Yeah, it's really heartwarming to do that group. I don't run it anymore, my colleague does, but it used to be the highlight of my week, actually. Yeah, Wednesday afternoon pain group.
Right. Yeah. We've touched quite a lot on the pain-killing medications, so the morphine-based things, the opioids, the gabapentinoids. We haven't spoken so much about what I might use an umbrella term for as the hypnotics like diazepam, the benzodiazepines, and the Z drugs, the zolpidem, the zopiclone. These are often used in people with anxiety and also with sleep problems, I suppose, broadly. Obviously, diazepam is also used sometimes in back pain and things, isn't it? But touching more on the anxiety side and the insomnia side, do you have any other thoughts there? Because that's potentially even trickier to withdraw these medications, isn't it?
Yeah, because there's a real risk if you go too fast that the adverse effects, when you withdraw it, when you're reducing them, the adverse effects can be really kind of dramatic, and it can be dangerous to come off of those medications too quickly. It is, again, though, it is largely about starting to, for us, engaging with people and starting to build confidence, starting to tease out little bits of progress here and there. So when you talk about anxiety, it's important to understand what anxiety is, and we look at that for our wellbeing sessions or in one-to-one, and really get to understand the person and how it affects them, because what you find doing this work with all the people and whatever conditions is that it's so individual, and the medications affect them in slightly different ways, all of them, and reducing off the medications can affect people in slightly different ways. I think that the key to coming off of reducing hypnotics is to go really slowly. Because, and it's the same with any of these medications, actually, start slowly, build the confidence that actually that little reduction didn't upend my life. And that builds confidence to move on from there. Mental health services, unfortunately, are really under the cosh. They're really underfunded. We could do with broader mental health services that can help, but there is a place for talking therapy sometimes, and things like Recovery College. So it's, again, building resilience, but mental resilience rather than physical resilience this time, to be able to move forward and start to feel the benefits of making the effort, really, to build a better life for oneself. Yeah.
It's really worth remembering, isn't it, you mentioned about psychological services and how CBT, so cognitive behavioural therapy, can be focused on pain and insomnia and can have amazing results, can't it? And I think we should remember that. And just to flip the coin then a little bit and think about patients who are concerned about potential dependence on medications they're starting, what are the proactive steps that you think patients can take when they're starting a new medication?
I think it's always worth doing a little bit of research yourself, but there's a lot of misinformation out there as well. So if you are Googling to have a look at what the longer term or even the short term effects might be, it's important that you use things like NHS websites. There's some very good websites out there that can help. But yeah, just have a look, see be clear what you're looking at. But ideally, really, you want to be having a conversation with a clinician who's prescribing them. If someone's prescribing you something, I think we're starting to move from that generation where doctors always write 100%, here's your prescription, off you go, I know best. So a gentle conversation, because doc's under pressure as well, but kind of, well, how long do you think I'll be on this for? Is this the top dose, or we're expecting to go up? Those kind of things. And they can be really difficult conversations for people who've got complex conditions. There's a lot of information to hold. So it's well worth kind of maybe coming back to the next appointment with a few questions prepared about your medications. And if you're taking medications for mostly about anxiety and chronic pain or even sleep, if you can take them as infrequently as possible, then that tends to help as well. And GP surgeries have pharmacists who are prescribing pharmacists as a rule, and they might ring up to give you a meds review. And they're great people, great sources of information to have a conversation with about kind of what harm might this be doing, what good's it doing. It's about balancing that harm against benefit, and that's the key really with medication, isn't it?
I'm glad you mentioned pharmacists, because they're more and more involved in helping people manage medication safely. And I think one of the barriers they sometimes face is, you're not my GP.
Yes.
And maybe you get that as well, which is funny, because, we're delighted for the help. The other aspect is that I think sometimes people feel we're cutting things because of the cost.
Yeah.
You couldn't get cheaper drugs than these, could you? It's not about the cost in any way. This is about what's right for people in the long term, isn't it? And the downsides are profound.
Absolutely. Very few of the medications that we're supporting the deprescribing of are particularly expensive. You get the odd one that is, but that's usually a variation on a theme. Yeah, because I did a lot of costing of the medications during the pilot of what we reduced. And yeah, it didn't come to, we reduced a lot of medications during that pilot, and it came to about half what it cost to have me for the year, which is possibly why they didn't refund it. But no, it is really is about well-being. So the people that go through the process, and they don't always come completely off of a medication, but they significantly reduce the medication and have a planned ending to their work with us. They tell us that we get them to score different areas of their life, and really quality of life improves by 18-19% on average. Mood improves by 19%. Sleep improves by 19%. Anxiety drops by 17%. Pain by 10%. So there's real, and activity increases by 12 to 15%. So there's real benefits to having a fresh look at your life, which is a lot of what we do, having a fresh look at your life, getting some coping techniques, maybe practicing a bit of gentle activity that's previously felt a little bit out of your comfort zone, maybe practicing a bit of mindfulness or breath work to keep yourself calmer on a regular basis, engaging with others, all these different things. They do have real knock-on benefits. And then when you are able to reduce or come off of these medications, you do find, that minds are clearer, people feel freer. Sometimes we work with people and their whole day is dominated by when's their next dose of medication. And I don't think anyone really wants to live like that. And that's a real key difference between the substance misuse work that you talked about earlier, or we talked about earlier, and the dependence forming medications work. We kind of almost draw a line between addiction and dependence. So one barrier we sometimes face is people thinking that we're saying you're addicted to this medication, you're an addict, you're a drug addict. That's not the case at all. They've taken these medications in good faith, prescribed by experts, as they say it, in their field for conditions that they need to take. And yeah, it is kind of, eating a bit of humble pie, really, isn't it, for the medical profession to go, do you know what? I know we've prescribed this for you for quite a long time, but we don't think it's doing you any good anymore. And we need to try and work with you to find a better way forward. Yeah.
Thank you. I just want to reflect on those figures. They're huge, aren't they? About 20% reduction in most of the things you're measuring by stopping a 10% reduction in the pain, albeit, but that's enormous and quite a significant increase in activity. And we know that activity, as well as stress and anxiety, have a huge contribution to lots of other illnesses. So there's a huge impact in the health and well-being in the long term, isn't there?
Yeah, and I think that has massive, I mean, who wouldn't want a 19% improvement in their quality of life, or 18% improvement in their quality of life, or their mood to improve by almost 20% and to feel that much less anxious? And that is kind of life-changing statistics, aren't they? Because when you're less anxious, when your mood's improved, when you're getting more active, you can achieve much more and have much more fulfillment in life. And suddenly the medications don't seem like the only way forward then. And it's about, some of our work's about getting people to, with all due respect, take the blinkers off a bit. It's horrible to live with some of these conditions, and I think the initial, and maybe over time it can get even worse, response of people is to kind of start losing hope, start losing belief in themselves, confidence in themselves and their ability, and kind of start wearing the label, oh, I'm a chronic pain sufferer, or I struggle with anxiety. And yes, that's true, but we try and help people to not let that completely define them, so that they can start to explore kind of what would give me some fulfillment.
You mentioned some resources earlier, like the NHS website. We can put them all on our website as well if you let us know. But any particular resources you had in mind that are good for people to be aware of?
I think for pain sufferers, livewellwithpain.co.uk is a really good site for both professionals and patients. Anybody who's suffering with chronic pain, or anybody who's affected by anybody else's chronic pain as well. And there's some real hopeful stories on there, as well as some practical tips. It talks about the pain cycle. So I'm in pain, so I move less. This means I become deconditioned. So when I do start to move, I feel more pain, and so on and so forth. It goes round and round in circles. It's a little bit trickier for kind of anxiety and low mood, but there are lots of apps that are really helpful. Things like the Calm app is quite good. Headspace is quite good. Some of them you can use for free up to a point. There's loads on YouTube for mindfulness and meditation or breath work. People can be a bit averse to the phrases meditation and mindfulness. But if you just look for something that's breath work, that's literally just breathing in a controlled manner. And that is very calming. It can be very calming. And if you practice that regularly, or even, just a few times a week is better than nothing, then what you find is when you start to get, if you can recognize when you're starting to feel that level of anxiety, me in my car, can't get here. Well, I'm not going to get there. Actually just taking a few minutes to be aware of your breathing can calm you down, slow your thoughts down. And it really is kind of sometimes slow down to be more effective. So yeah, there's lots out there for people to explore. I'll try and find some links I can send you through.
Thank you. That'd be great. Talking about breathing, it just made me remember the importance of it. Controlled breathing. Box breathing is one technique, isn't it?
That's right.
And it's very simple. I just want to also highlight that it's not just about clearing your thoughts, is it? There's clearly implications on your levels of hormones from doing that, isn't there? So I think breathing like that stimulates the vagus nerve, which is a nerve that slows your heart rate down. We know that reduces, the adrenaline that's going around. We know that if we have reduced variability in our heart rate, that reduces the stress hormones and long-term outcomes. So it sounds all a bit mumby-jumby, doesn't it? But it's not. And it is around trying to encourage people who are a bit averse to thinking this is a bit of a load of rubbish to really see the benefits, isn't it?
Yeah, it's a real basic thing that we do without thinking, isn't it? Breathing and actually just bringing a bit of your mind to bear on it and controlling it, and in using any of those techniques really can, have some brilliant knock-on effects for you. Yeah, and another one is it's not for everyone, but yoga can really help a lot of people. Which, you know, I can hear people with chronic pain laughing now, saying, "You're joking," but actually, there's things like chair yoga that can be really good. You can see that on YouTube. That's really helpful for people. And if you are feeling particularly brave, you could read The Body Keeps the Score, which is a great book about trauma and getting over trauma. And yeah, he's certainly a big advocate. I can't remember his name right now, but he's certainly a massive advocate of yoga as one of the techniques to kind of help you move forward, because it not only stretching and movement, but it's breathing at the same time. So it's bringing those things together, and actually that can have lots of different benefits. Activity and movement. We say motion is lotion with most conditions, and getting moving, even if it's just, okay, you're in a lot of pain all day long and you can only get up once an hour and have a wander around wherever you live, or, you know, if you can make it down to the shop and back or something like that once a day, anything like that, anything that's just pushing it a little bit more than you have before is important. But it's avoiding boom and bust as well. So people in chronic pain or with anxiety wake up and think, oh, actually, today's not so bad. I'm having a good day. Right. I'll get the shopping done. I'll do the housework. I'll go and pay those bills. I'll go and see my friend that I've been meaning to catch up with. And by the end of the day, you've bust again. And the next 3 days are wiped out. You know, they're spent in bed or recovering or feeling awful. And then you get another good day and you do it all again. And actually what we find is if people can graduate their activity, and what this really means in practice is taking a break before you need it, then you start to pace. And I'll send you a link to a YouTube video, a woman who's written 3 books by pacing. So she'll sit and she'll work for 20 minutes and then she'll take a 15-minute break and then she'll come back and work for 20 minutes. And she talks about how she graduated her swimming as well, because she was your archetypal boom and buster. Brilliant. I can swim today. And she would get in and do 50 lengths, which terrifies me, the thought of doing 50 lengths, but she would do 50 lengths and then that was it. She was ruined for the week. And she's learned to find the levels where she needs to stop. So stopping before you really need to is key. We had a gentleman who was working with us, and it took a little while to convince his wife, because he had a big garden and it was mostly lawn. So he would go out and he would mow the lawn for 15 minutes. Then he would come in and have a nice long break and a cup of coffee. And she would be, well, why are you doing a bit of the lawn and stopping? But actually, they both saw over time that actually he was able, by using that kind of method to get things done around the house, he was actually able to get far more done than he was before.
Mm-hmm. Fascinating. Pacing, maybe one of the take-home messages, isn't it? Because it's pacing not only, for example, reduction in drugs and doing that gradually, but also pacing your activity, and absolutely see that. The interesting thing for me is that I think a lot of people who are used to being, you know, very high achievers, being incredibly good at what they do, are the same people who can't believe that they're not able to do it anymore. And it's that characteristic of being so driven and so good at something that is almost perpetuating that sometimes, isn't it?
Yeah, if you look at Peter Moore's Pain podcast, and he's got a 12-step plan, which resonates with substance misuse, but it's completely different. One of the key things about that, in fact, one of the first things is acceptance. So it's accepting, where am I at now? And that's not about giving up. That's not about saying, oh, well, I'm knackered now, or my back's busted, I can't, or my leg, or whatever it might be. I can't do it. I can't do that anymore. It's about accepting, okay, this is where I'm at now. And what does that actually mean in practice? So where can I go now? I mean, one of the, you know, if I say to patients when they first come in, or often will say, you know, where would you like to get to? And they say, I'd like to be pain free. That's not always realistic for people. And I think that's important for them to accept, and for clinicians to kind of be clear about. It's not that you're definitely not going to be pain free ever, but, you know, at the moment, I can't see a way that we're going to be able to resolve this pain. So learning to live with that and move forward. And with the medications, it's a marathon, not a sprint. It really is a case of, like, come off them in a way that causes the least adverse reaction in your body and your mind as possible. So, you know, most people that we work with have been on these medications for a long time, years and years, many of them. And sometimes they're really keen to go fast. especially, high achievers, people who want to get things done, and you tell them about the longer term harms, and they can be, well, I need to get off them and I want to stop them now. And actually that's not always the best way to go. Worked with a chap called Andrew, who was an Eastbourne client a couple of years ago, and he lets us use his name and his case as a study and to tell people about. And he didn't realise he was suffering from hyperalgesia. So he would get in the bath, and he was on about 120 milligrams of morphine, and he would be in pain for hours. He had all these kind of new pins and needles. He described it as like someone slitting the skin all over his body for 6 to 8 hours after a bath. And I was thinking, I would have stopped bathing at that point, I think, and just got smelly. But once he realised it was hyperalgesia, he started coming down at 20 milligrams a week. And we wouldn't have, against our advice, but when he got to halfway down, it suddenly hit him like a train, and it affected him emotionally, mentally, physically. And we just went back up a little bit and came down much more gently. And he had a far better experience coming down for the last half of that medication, and managed to be, dependence medication free by the end of that time.
Fantastic. Yeah, a whole plethora of examples. And you've touched so many people's lives. I had a question that we've kind of answered now from the previous guest on our podcast, Roger Prentice, which is around what resources are there. So I think we've answered them. We'll put them on the website when you kindly share them. For me, a take home is a book I'm going to buy is The Body Keeps the Score, though. I'm interested.
Yeah, it's a tough read because it talks in quite a lot of detail about trauma, but as you get through it, it starts to become more positive about the ways that people can be supported. Another couple of points I'd just like to make for anyone suffering with chronic pain who's on opioids. If you've ever missed a few days of your medication because there was a mix-up with the prescription, or you ran out for some reason, or you lost it, you would have gone into withdrawal. An opiate withdrawal plus chronic pain is agony. That is not your baseline pain score without medication. And that's a kind of misunderstanding that people have. I missed it for a few days. I was in agony. You can't take this away from me. No, you were in agony because you were in opiate withdrawal plus your already existing condition. So coming down gently actually doesn't leave people in that extra pain.
And I think it's fair to say that the vast majority of people who are on opioid medications for non-cancer pain have kind of reset their pain perceptions by the medication. Is that fair to say? So if, for example, we're saying, we know you've got pain, but your pain is worse off this medication immediately, it won't be forever. Is that everybody? Is that the vast majority? What?
It's really individual. So yeah, I think if you come down at kind of 10% or less at a time and come down in graduated intervals that you feel ready for, because life events can happen while you're deprescribing as well. Sometimes it's necessary to pause. But we do find that people are not in increased pain. It's very rare that anybody says, no, my pain's going up as we're coming down. And if it is, then pause it for a bit. There's no need to come down any further at this point. Let your body get used to the new level, because our bodies quickly become tolerant to these medications. And that's why they have to go up and up and up and end up at some of the frankly ridiculous levels that we sometimes work with people with when they're starting treatment with us.
Thank you. So I can see that the biggest gift you give really to people in many ways is your time. It's an incredibly complex thing to support people to do, isn't it? And the gift of your time is an incredible.
I think that's the key, that we do have that bit of time, and giving our time, making it about them and being led by them wherever possible. So we might make suggestions on kind of the next step forward. Have you thought about 5 meal reduction? Have you thought about doing some breath work, those kind of things? But we don't push people. It's important that people, none of us like being told what to do we? It's much better if somebody suggests something and we can go away and have a think about it and then maybe explore it a bit and then try it. And also, it's about enabling people to kind of, try a little reduction. So you're on 120 milligrams of morphine. Well, let's take 5 milligrams away. What would that be like? You're not going to notice that. So you start to build that confidence then in kind of making the next step, Have that little walk that you've been thinking, it'd be nice to have that walk, maybe start by just walking to the end of the driveway and back, or the end of the road and back, just to build slowly. These are long-term conditions. These are long-term prescribing issues. It's important that people work at a pace that they can work at, and that they put themselves at the centre of what's going on. They do what they can. If we do what we can to self-manage our problems, then we tend to find that we need less medication over time.
Thank you. So in terms of a theme of some take-home messages I'm hearing from you, I think is something around accept where we are today, regardless of how we've got here.
Yeah.
Be open to change, invest time.
Definitely.
Pace.
Yeah. And make little changes, regularly. So if you're starting to do that little bit more activity, don't expect yourself to also make big reductions in your medication and go and see that person that you haven't seen for 6 months and join the club. Maybe do one thing at a time, because then you've got, and the same with the medications, reduce one at a time, focus on one and bring that down. So if you're on 2 or 3 of these medications, pick which one you think you're going to be able to tolerate the change first and work on that, because if it's difficult, you know why. So you know what to do about it. If you're trying to come down off 2 medications, or you're trying to change 2 or 3 different areas of your life all at once, then you're not quite sure what's throwing you out of kilter if you have a problem. If you're doing 1 or 2 at the most, then you've got a good idea what's going on, and you can rectify it then.
Robert, thanks for the gift of your time and demonstrating how, you give the gift of your time to lots of people and your colleagues, and demonstrating that isn't a pill for every ill, is it? And actually quite the opposite. On our next podcast, we're speaking to Nermit Upadhyay about chronic condition management with digital tools and lifestyle and behaviour change using health apps. Got a question you'd like to ask him?
I have. Yeah. First of all, it's been an absolute pleasure. Thank you for allowing me to come on and share our experience. My question would be, how would you overcome reticence in using technology, particularly with older patients?
Thank you. And I wonder if he's got an answer to that, because it's really tricky, isn't it?
It is tricky. And we try and support people to join our online wellbeing sessions, for example. And some of our cohort people that we work with are kind of, a bit nervous of that, or they don't really use email. They don't really use iPads or phones in that way. So we try and talk them through it and allay their fears a bit, and get them to try it on a one-to-one basis, perhaps before they try and join the group. And also, people are nervous about coming into those kind of sessions. So we'll say, well, you don't have to speak if you don't want to, and you can have your camera off as well if you want to. You just listen in and see what's going on, see what's going on with other people, and hopefully discover, I'm not so unusual after all. There are plenty of other people out there in similar situations.
I have similar concerns, because health inequalities, where the people who need the most help might be least likely to get it, can easily be demonstrated with digital technology, can't it?
That's very true.
We need to be really careful. So I will explore that with you. Thank you very much. Thanks for joining me.
Real pleasure. Thank you.
You've been listening to the Health and Wellbeing podcast, where today's focus was on supporting patients prescribed dependence-forming medications with Robert Ralph and me, Dr. Nick Harvey. For more information and resources, check out our website, sdhc.org.uk. If you have any feedback or suggestions for future episodes, please email us at sdhc.feedback@nhs.net. Join us for our next episode, where Nermit Upadhyay will be coming to share insights on leveraging digital tools for managing chronic conditions and the impact of health apps. Please take a moment to subscribe to help support us in empowering others with their health and wellbeing.